Knock, knock, knock.
Come in.
Hi, Cindy. My name is Jenna. I'm the occupational therapist. I'm talking with you today.
Hi.
How are you?
Well, I'm doing okay.
Okay. It looks like you had a little bit of a mishap. When I look at your chart here, you want to explain kind of what happened?
Yeah. So, I don't remember a whole lot of it, but I'll try to tell you what happened. I have horses, and I love to ride horse. So I was out at my parents' home, and that's where we keep our horses. And I was riding horse with my daughter. We went out for a ride, and either the horse got spooked or maybe tripped a little bit, and I lost my balance. And I think I just when I lost my balance, I just fell off. And the last thing I remember is I fell off and I had a sore shoulder. I went to the doctor, and then the doctor told me a bunch of stuff, and I don't remember a lot of what he said, but I was just wondering if you could help me to understand maybe what really happened.
Okay, yeah. I also have some questions for you too. I'm a horse person too. I have horses as
Nice.
well. So that's kind of fun. But did
Nice.
you lose consciousness at all when you fell?
No, I think I was awake the whole time, and my daughter said I was awake too, that I never passed out.
Okay, good. And can you rate your pain scale for me? Do you know what a pain scale is?
Not really. What is
Okay, so a pain scale is, we'll rate it like from 1 to 10, whether 10 being you have a lot of pain and 1 being you don't have much pain at all.
When it happened, it was pretty painful. So
Okay.
the number was pretty high, like maybe 8 or 9.
Okay.
But right now, it just kind of aches a little bit.
Okay.
It hurts more when I move it.
So it's getting a little better. Okay. Well, that's good. All right. Well, I can kind of explain to you probably what could have happened. So I have a picture here of your glenohumeral joint, and there's 3 bone structures that are involved with this. So you have your clavicle, you have your scapula, and you have your humerus. And then you also have bones or muscles that are attached, and they, help move that muscle all those certain different ways. And your glenohumeral joint is pretty versatile, so you can move it in a lot of directions. And then there's also 4 kind of types of fractures. So here's another picture that kind of just explains the different types of fractures that can occur. So type 1, which is similar to what you have, and none of the bones have been displaced, so surgery probably isn't what's going to be an option for you. Type 2, 3, and 4 are the bones have been displaced and more commonly will associate with some surgical instruments being involved there. So that's kind of, and then as you have fallen, I could see that the humerus fracture usually happens with an outstretched arm. So as you fell, you might have reached out and tried to brace yourself, and then that causes the arm to go back into and hit different structures involved. So that could have been, a pretty common way that maybe you had fallen onto your arm.
Okay.
Does that make sense?
Yeah, it's nice to see these pictures too, because I really couldn't grasp what really happened. But now to see the pictures, it makes a little bit more sense, and I can see how that would happen when I fall and try to brace myself. So that makes a lot of sense.
Good.
But now, really, how common is this injury?
It's pretty common. It's one of the most common humerus fractures that can occur. More fractures happen in that proximal area of your humerus. And it's very common in women. So with your scenario, it kind of makes sense.
Okay, so what kind of symptoms should I expect from this injury?
Okay, so immediately after your injury, the common symptoms are swelling, pain's going to occur, you might have some weakness, and then because of all those muscles getting tight from the swelling, you're most likely going to have some loss of that movement as well.
Is this injury going to take a long time to heal?
Typically, the outcome is 6 to 8 weeks. Healing depends on the person, so everybody's different, but that's kind of like the typical range is that 6 to 8 week mark.
Okay. What are the chances that I'll get all my movement back?
The chances of getting your movement back are very good. You don't have any displacement, so surgery is not really an issue. We're going to really want to work on immobilization at first. So that first couple weeks are going to be just, really using your sling and keeping that in mind. I do have another handout that I'll hand to you, and it's kind of just outlines the weeks that are involved. So from that 2-week mark, we're just going to be immobilized for the most part and kind of maybe working on the elbow and forearm, You do that about 6 to 8 times per day, and for 30-minute sessions, or similar to 30-minute sessions. Then when you hit that 4-week mark, we're going to start doing some range of motion exercises. So that will include the shoulder, so we'll be able to take it out of your sling and kind of work on a little bit more of that motion, and then we'll bring that forearm and elbow involved as well. When you hit that 6-week mark, then we're going to work on the full range of motion exercises. So we're really going to get that shoulder to get that full range of motion back. And of course, we'll keep integrating that elbow and that forearm involved as well. At your 8 weeks, then we'll start doing some strengthening. So whether that be with some TheraBand exercises, doing internal and external rotations, adduction, abduction, things like that. And then maybe some hand weights getting involved, getting your bicep activated, and things like that. And most commonly, it'll be, an at-home exercise therapy program. So I'll give that to you, and you can kind of look at that. And if you have any questions, feel free to contact me about that as well.
Okay. What are there things that I should do or things that I shouldn't do to improve my outcome?
Yeah. Keeping your health is very good. We want to, it has been shown that people who don't keep up with their health and are not as healthy, that they don't follow that exercise program that we're going to set you up with. And we want to begin that therapy, right around that 2-week mark so that we can get your shoulder moving as quickly as possible. That home exercise program with those exercises that I kind of mentioned earlier will be very helpful in strengthening that shoulder and getting it back to your normal range of motion back.
Okay. Can I do normal household activities?
Mm-hmm. Yeah. Do it based off of your comfort level. So we want to keep you comfortable. We don't want anything too painful. Some pain might occur as, you fractured your humerus, and so pain is going to occur. So we want to, do whatever feels comfortable for you. And
okay. Yes. Can I go back to work at some point?
Mm-hmm. So that's another good question. You'll want to keep in touch with your supervisor and make sure that they let you know, when you're coming back and things like that. You'll probably be on restrictions at the start, but then you'll kind of get back into that normal routine as you get back into work.
Okay, that's nice to know. So I work as a nurse, so it's kind of nice to know that I have some options there.
Right. Yes.
I have another question too. As far as insurance goes, the therapy programs and things you're going to offer for me, the appointments and stuff, are they covered under my insurance?
Yep. Another great question. So we want to keep that involved as well. So on the back of your insurance card, there will be a phone number. And you're going to want to call that phone number, and they can answer more questions for you in regards to that. So, and then you can get a hold of the operator, and they'll be able to help you more with questions like that. Does that help?
Yep, that helps too. And then another question here too. Now you mentioned that I'd be wearing my sling for support. Mm-hmm. How long, or do I have to wear it in bed?
You don't have to wear it in bed. And also when you're doing your exercises, we want to make sure that that sling is off so that we can get that range of motion going. When you're out and about and kind of doing some errands and things like that, we want to make sure that we're wearing it just to keep that. When you're doing things, you sometimes maybe forget about it. And so we want to make sure that that sling is being used, and when you're out in the community and such things like that.
So it's kind of like a reminder to be careful.
Yes, a reminder to be careful of that shoulder joint. Like you injured it, so we want to make sure that we're keeping it healthy.
Okay. And here's the all-important question now. Mm-hmm. When can I ride again?
Yes. So that's also going to base on yourself. So we want to make sure if you're in a lot of pain, I would suggest not getting up on that horse. And with being in that sling for that first 2 weeks, I would probably wait till after that 2-week mark. We want to make sure that your shoulder is able to get you up back on that horse. So making sure that you're keeping track of your pain. So if you're in too much pain, don't get up on that horse. If you don't have pain, go right ahead. I would say why not.
Good. I like your answers. Thank you. You gave me a lot of good information.
Yeah.